one of the things that I have focused on lately is women who are pregnant. Because culturally, if you've had one child, you probably won't go to the doctor till you're about 4 or 5 months pregnant. You
Right.
know, and that's not the best for you or for the baby, because every pregnancy is different. So to understand that once you realize you're pregnant, and let me just look at Facebook. You know, don't tell them lies. You know, miss the cycle. You know, your appetite done got, you got something kicking around. It's a baby. It's not gas. It's a baby.
It's a baby.
It's a baby. But the importance of that, you know, and for us to understand the importance of taking care of ourselves, even if you had one child, that each pregnancy is different, and the importance of going that first trimester to seek out medical care.
It's sorry, but it's so important, and I'm passionate about women's health, prenatal care, because we offer women's services, OBGYN services through Florida Community Health Centers. When we look at the numbers, we have about 40% of the women that come in during the first trimester, about 40% of the women come in during the second trimester, and about 20% of women coming in the third trimester. So, and the trimesters are the pregnancy broken down into 3 groups. The first 3 months, the importance of getting in the first trimester, and the first 3 months is, I can't stress enough how important it is. In our community up here in St. Lucie County, maternal fetal health is not where it should be. Morbidity and mortality. What morbidity means is suffering. Yes. Mortality means death. So maternal fetal, the mother and the baby, suffering and death is much too high in St. Lucie County.
I agree.
And a lot of that is attributed to late entry into care. So if you're getting in after that 3rd month, you're already behind the 8 ball.
Yes.
This is of the utmost importance.
Right.
For the mom, for the baby, for the health of the family. Because it's not just the mom and the baby that suffer, it's the whole family. People, you know, people got families, they got friends that care about them. And it's a tragedy when you have a bad outcome in a pregnancy. The best thing you can do in a pregnancy is get in to see your OBGYN doctor.
ASAP.
ASAP. And don't get caught up in, there's a lot of community nonprofits or community entities out there that are offering ultrasounds free of charge for underserved women. They're not offering health care. They're not offering
Can you say that again, please? Because there is a difference.
There's a huge difference, because now you get all the warm and fuzzies of seeing the baby on the screen, but you're not being offered any type of health care. You haven't had any blood work done to see if you're healthy and at maximum strength to carry this baby and have a very healthy baby when they're born. When you go to those, and I'm not saying don't go to those places. I think they're great for what they do, but don't mistake that for health care. You need to see an OBGYN clinician, either a midwife, a OBGYN physician, a women's health nurse practitioner, somebody who's trained in pregnancies to see you and get in as early as possible. The earlier you get in, the better chance that you and your baby have of being healthy at the end of it.
So how many Florida Community Health Centers are located in Fort Pierce?
We have 3 health centers in Fort Pierce.
3.
Okay.
Yeah, we have 3.
All 3 of them do the
2 of the 3 are OBGYN.
Okay.
Yes.
Okay.
We have one Grace Women's Health Center. We have one in Lincoln Park.
Yes.
And both of them offer women's health services.
Awesome.
We have one on Delaware that offers all of the other services besides the women's health service.
And the other part about that is too, well, I'm not working, you know, I don't have insurance, I don't have a way to get there. All of those excuses have been eliminated. Completely eliminated. In the state of Florida, when you become pregnant, you automatically can get insurance through Medicaid.
Yes, ma'am.
And so with Florida Community Health Centers and other agencies as well that do healthcare, they have individuals there working for them that can help you fill out the information in order for you to qualify for Medicaid. What we're saying to you is that this is very important. You know, no one wants to look at losing a child or having to deal with, you know, having a child to come into this world with something that could have been avoided. And so this is what we're saying, the importance of health care. And so, well, I smoke weed. Baby, you was smoking weed when you got pregnant. We got you. Okay. We're not looking for drug use. We're looking to help you have a healthy pregnancy so you can deliver a healthy child. And so I think that's very important for us to be able to stress that more and more, is that the minute you miss that cycle, the minute you feel like you might be pregnant, you need to call Florida Community Health Centers and get set up with an appointment in order to receive prenatal care. And there's so much that go along with that. I just want to say that because you have the support system that you need. If when you can go in and see a nurse practitioner or see a doctor, you have people that you can talk to get information. Now, I know back in the day, this is one of Pastor Hayes' testimonies. I was pregnant with my first child, and I was sitting around, and my aunt was there, and my mom, and they were talking, and I declare for God, this is what my Aunt Lily said, that when she was in labor, she saw the pains coming down the wall and then coming up the bed rail and hitting her. So this is my first pregnancy.
Right.
Okay? I'm freaking out. Like, pains coming the wall, and then they attack you. And so there's so many myths out there culturally, so many myths and so many misconceptions that we can get good information, true information, based in facts, in order for us to make sure that we deliver healthy babies and have a really healthy pregnancy. One of the things that we do over in the Lincoln Park Center is that every woman that comes in for prenatal care and delivers through us, being that partnership with Florida Community Health Centers and In the Image of Christ, we have a basket that we give them. It has diapers and diapers and bottles, both start with a B.
We might throw Bibles in there.
I defaulted to what I'm used to, but we get that. We give them a basket for the babies and for themselves, and this just that encouragement for you to come in and get the help that you need. The other part about that is too, there's other things that go along with being pregnant. You may start having some mental health issues. You connect to the Florida Community Health Centers. They have those in there where they can refer you. But to sit in the house by yourself trying to figure this out is what we don't want you to do. To hide because you may have an addiction problem is not what we want you to do. Nobody wants to take your child away from you. We are here to help you, to deliver and just move forward with just being healthy and happy.
Absolutely. And one of the blessings of Florida Community Health Centers and other entities such as Florida Community Health Centers is that we specialize in healthcare, and in particular for those who feel like they don't have access to it, who feel like they don't have anywhere to go. We don't just have the clinicians at the office. We have care managers that work with you. We have health benefit coordinators, as Pastor Hazel mentioned, that'll help you get assigned or signed up to any kind of government assistance that's available to the individual. We provide culturally sensitive care. We are not judgmental. We're not there. We don't even ask your residency status or citizenship status. None of that matters to us. All we care about is you're going to walk in that door. If you walk in because you drove there in your Bentley from your mansion, or if you just walked out from under a bridge, we're going to be treating you the same. We have all the same resources you get at a private clinic at, well, I would say at an affordable cost, and many times at almost nothing.
Right.
We have a sliding fee scale for patients who struggle financially. And those patients will come in and pay, I think, $20, $25 to see the doc, get their blood work done, get an EKG done, get everything done. And if they can't pay that, then that's fine too. They need to get a follow-up appointment. They can come right back and even have owed that money. They're not going to be refused services. So we want you to feel comfortable coming in. If you feel like you have nowhere to go, this is the place to go, because as Pastor Hazel was saying, if you had an issue at home with your plumbing, you're not going to sit there and try to figure out how you're going to fix this plumbing because you don't have the knowledge. If you have to rewire your house, you're calling an electrician.
Right.
So it doesn't make sense when you're dealing with health problems to try to sit there and deal with it on your own. You have resources. You have help.
Right.
And Florida Community Health Centers is there for you.